The rain we're seeing this morning is helping firefighters battling the wildfire burning in Parley's Canyon. That fire has forced many people this week to evacuate their homes. Thankfully, everyone displaced, they're now allowed to go back, but disasters like wildfires, flash floods, and others can take a toll on people's mental health. The Utah Red Cross does have some resources to help people emotionally recover after these disasters strike. So joining us to share some of those tools is Michael Smalden, the Executive Director of the Northern Utah and Southwest Wyoming chapter of the Red Cross. As you can see through Zoom, we also have Michael Johnson, the lead disaster mental health volunteer for the Red Cross. Gentlemen, both of you, thanks for being with us here today.
Thank you.
Thank you.
So let me start with Michael here with you. We don't often hear about the mental health aspect of some of these disasters.
Yeah, and we took a look at that as the Red Cross, and in 1992 we looked that a lot of mental health issues were coming due to disasters and that we needed to do something about it. So we pulled in our mental health volunteers and Corps to help deal with the mental health issues that happen due to disasters.
So Michael, you're one of those mental health volunteers here joining us through Zoom. What do you see as a volunteer?
Well, when individuals go through disasters, whatever they are, there's always a lot of grief, there's pain, there's anger, and every individual reacts a little bit differently, but there are some things that we can provide to help them, to comfort them, provide some local resources, to get assistance when they need it.
So what are some of those things that you provide with them or suggest that they do to be able to help deal with the mental health aspect?
A lot of it is helping them just notice the first steps that they need to take. Sometimes there's so much overwhelming, so many things going on, they don't even know where to start. So the Red Cross provides counselors, mental health volunteers to help take some of those first steps. And then if we find there's something more long-lasting that's needed, we'll reach out to some local resources and try to connect the individual with something locally to get more long-term care.
And Michael, here in studio, what are some of those resources that Michael is mentioning?
Yeah, a lot of those times it's just coping mechanisms on how to deal with it immediately and the stresses that come to you. Some breathing exercises, some type of strategy that's going to help them get past the immediate mental health crisis that's occurring with them.
So it's just really basically learning how to cope with the situation at hand.
Yes.
Okay,
Yeah.
and Michael, there joining us through Zoom, I understand you have 5 suggestions to help people kind of mentally get through some of these disasters.
Yes, there's a lot of things that we can do to help clients get through. Many of these things are almost common sense. The first thing we got to reduce your chance of physical harm. So if it's right in the immediate moment, get out of harm's way. And then first thing, you have to take care of yourself. You should stay connected with friends and family, use your resources you have available. Look to the future. Keep an eye out for what's coming, and then look for the resources you need and reach out. Don't be afraid to ask for help.
There's a couple of just smart reminders there, and of course people want to be able to see those and kind of get that information for themselves, how they connect with the Red Cross.
Yeah, they can go to redcross.org or 1-800-RED-CROSS.
There you go. Of course, we'll have a link to that on our website, abc4.com/GMU. And quickly, before I let you go, I know you're really working to get blood donations up here as well with this whole thing. There's a competition, Utah State, Weber State. Where do we sit with that? Yeah,
so we are still looking for people in the community to sign up for to be a part of this historic blood drive. We're looking to do 2,000 units there, and so we are looking for the community to join in and help us get blood to the important people who need it.
Okay, so helping people with their mental health through disasters, and of course looking for blood for those emergency situations when we need it. Michael, and of course Michael there through Zoom, thanks for being with us here today.
Thank you.
The time is now 6:38.